Hello everyone and welcome to Pride Action TV. My name is Kim Hunt and I'm the Executive Director of the Pride Action Tank, which is a project incubator and think tank focused on the LGBTQ issues. Pride Action Tank is also a project of the AIDS Foundation of Chicago. And we do the show the first Friday of the month, every month, and we're happy to be here again. I want to remind folks that this is a call-in show, and the number is 312-738-1060. So if you have any questions or comments while we're doing the show, feel free to give us a ring and be a part of the conversation. So I'm very excited to have our guest tonight. And I think it's very apropos that you're here given what's going on in our country right now and the tenor of things that are happening. So with me today is Brigid Leahy, who is the Director of Legislation for Planned Parenthood of Illinois. And just briefly, and then we'll let Brigid talk more about what Planned Parenthood does, but Planned Parenthood has been around for nearly 100 years, which I find amazing. It's been building healthy communities, and every day Planned Parenthood of Illinois helps all kinds of people get health and the tools that they need and the information that they need. And when I say all kinds of folks, I mean all kinds of folks. And I think, Brigid, people don't really know the breadth of services that Planned Parenthood offers. So can you give us a little taste of what services are available?
So Planned Parenthood of Illinois has 16 health centers throughout the state. About half of them are in the Chicago area. And we provide a broad range of reproductive health care services to no matter who comes to us. We are not concerned about where you live, what your ethnicity is, your gender, whatever it is, your income. We take all forms of insurance, Medicaid, marketplace plans, private insurance. We are there to serve communities that need our services. And our services, like I said, are a broad range of reproductive health care services. So that includes everything from well women visits to your birth control to STD testing and treatment, HIV testing. And we've been really trying to listen to the needs of our patients in the last few years. We did a study a few years ago to look where we had needs across the state and to try to make sure that we were providing as many services uniformly across all 16 health centers. So in the last couple of years, we have broadened some services like medication abortion and in-clinic abortions to other health centers in the state. And we have also been looking at serving communities where there are no services for certain things. So, for example, in downstate Illinois, in Peoria, we have a health center there that provides PrEP. And it is the only health center, the only provider in that county or the surrounding counties that provides PrEP. In Springfield, Illinois, where I am based, that health center recently rolled out transgender hormone services. And we did that because we had partnered and talked to the local LGBTQ center, the Phoenix Center, and learned that they have clients and they have people who are going up to Chicago, coming here, and traveling, 200 miles. I did the trip yesterday, and it's not pleasant to have to do on a regular basis just for your health care. So we decided it was important to offer that service in Springfield. So we're there for all of our patients. We pride ourselves on providing services with respect and without judgment, no matter what.
Thank you for sharing that with us. I think people really don't understand how critical Planned Parenthood is in some communities. We hear, if we just counted on what we hear in the national news, for example, we'd think that Planned Parenthood only provides abortion services. And what you're saying is that there are a range of services, and for some individuals, this is the place that they go for health care in some communities. I mean, we get a little spoiled in Chicago because there are options, but I think even in Chicago, the fact that half of your centers in Illinois are in Chicago, that says something too about what folks need and what folks are able to pay for, and definitely the services that are needed.
Yes, we feel it's really important. We're a mission-driven healthcare provider, and we're a nonprofit. So I think that makes us a little bit different than some of the other providers out there, because we have a commitment to provide services particularly to low-income individuals or people who are marginalized in some way. And so we have health centers that are in underserved communities that there aren't other services available, or we're in communities where we may be the only provider where you can get in a reasonable amount of time if you're a Medicaid patient, because private providers will limit the amount of Medicaid they take. So that is part of our mission. Our commitment is to make sure that we're providing services to those most in need.
And I'm glad you mentioned Medicaid. You and I met over the phone a few months ago now when we were putting together this legislative breakfast last month with some of the members of the Illinois congressional delegation, and you were gracious enough to be on the panel that morning at 7:30 in the morning. I really appreciate that.
I'm not a morning person.
Me either, but so many people are, so we did it in the morning. And I think a lot of people don't understand that, and I want to talk about the Affordable Care Act, but the Affordable Care Act by itself, in and of itself, isn't enough to cover some of the lowest income folks in our communities. It is Medicaid expansion that is helping with that. So let's talk about the ACA for a moment, and in particular, women's health, and how ACA has really just expanded the range of services available for women, and taken away some of the tax on being a woman in health insurance. So can you talk to us a little bit about the ACA and the potential of what we may be losing with the repeal and not knowing what the replacement is going to be?
Well, there are a number of things to keep in mind with the Affordable Care Act. First of all, I'm glad you brought up the Medicaid expansion. That is part of the Affordable Care Act. So we already had Medicaid in Illinois, but the Affordable Care Act allowed Illinois the opportunity to expand coverage to a whole group of individuals who never had it before. These are people that their income is so low they cannot afford to pay, even with subsidies, a premium for health insurance. This is the first time that people who are single without children were able to be on Medicaid, and that is huge. Young men, for example, that's very important. They never had access to Medicaid before in many circumstances. So that's huge, first of all. And hundreds of thousands of people in Illinois have benefited from that, and it's very, very important. And the Medicaid program in Illinois, when it comes to women's health services, is fantastic. Under the last administration and continuing under the current administration, there is a commitment to make sure that women have access to family planning services. Providers are supposed to have the full range of contraceptive methods available and offer them to patients. So this is very important for women's health care. The Affordable Care Act also has a separate women's health component when it comes to health insurance. And I think a lot of people may not understand when it's in the media about the Affordable Care Act. Often it's talked about in the terms of the access to insurance people gained through the new marketplaces. And you get insurance, and if your income is within a certain range, you get to have subsidies to help you pay for your insurance coverage. But a significant thing out of the marketplaces is this thing called the minimum health benefits that have to be in a plan. And that extends not just to these marketplace plans over here, but it also extends to all of the current plans that were already in place. So for example, I don't have insurance through a new marketplace plan that was created by the Affordable Care Act. I have insurance through my employer. But the benefits for women's preventive health care apply to my insurance plan the same as they apply to those other new plans that were created by the ACA. If the ACA is repealed and we do not have an adequate replacement available to us, women would lose out. There are a whole range of women's health care services that are included in everyone's health plans right now that are no copay, no deductible spend down. You're paying your premium so you get these services. They include an annual well woman visit. They include things like for pregnant women, testing for Rh negativity, prenatal vitamins, various counseling and testing. After women give birth, there is support for breastfeeding, including coverage for breast pumps, which is very important. The Affordable Care Act is focused on prevention. We know that breastfed babies are healthier, and so there was a real effort to support that for women. Women on Medicare, we don't even often talk about Medicare under the ACA, but they get these benefits too, including getting an annual mammogram. So older women have benefited from the ACA, even if they're on Medicare. There's also a big part of this is access to birth control without a copay. And that is really important because what we have seen is since this preventive health service benefit package went into place, because the well woman visit is covered without a copay and you have the birth control covered without a copay, women are now first getting access to birth control coverage, which they never had before, so they may now be getting coverage, and that's really helping them economically. They're not having to pay out of pocket. They're also getting coverage for better methods and more effective methods. So what that means is a woman may have been using the pill, but it's not ideal for her. She may not always remember to take it. It's an effective method of contraception, but it's not as effective as an IUD. However, an IUD can cost several $100s up front. And previously, if that was not covered, a woman had to come up with that money up front out of pocket. Under her current insurance, it is covered. And an IUD, if you're getting a Paragard, for example, that can last up to 12 years. A Mirena, which has hormones in it, that can last up to 6 years. You don't have to remember it every day. It can be very important for a young woman who's starting out in a career and wants to postpone childbearing. It can be important for a woman who is feeling that her family is complete and so she wants to use this method. So it's really a wonderful thing for women, and we have seen an uptick in the use of more effective methods of birth control because of the ACA.
And now that's being threatened.
Yes, unfortunately.
You shared a story with me of what happened the first week after the election, all the phone calls you got for IUDs, just because folks are just really so scared that these services are not going to be available, and rightly so. I mean, this package was not the norm before.
Right. So when I started working for Planned Parenthood back in 1993, it was very evident that we had to fight for a lot of things to get covered in our state insurance code, because insurance plans have always viewed women as being odd. We're not normal, okay? The man is the norm, and things for men usually get covered without much consideration. But things like birth control or even your annual exam with your gynecologist was considered an extra. Now, Planned Parenthood patients are very savvy. I think a lot of women who go in for regular care, they're very savvy about this, and they know what they need, they know what they want, they know what health coverage they have. So after the election, when it became evident that we were going to have a president who was committed to repealing the Affordable Care Act, and we have a Congress that has voted repeatedly to do that already, many of our patients were very, very concerned. And we saw a swing in the request for online appointments, which you can book at www.plannedparenthood.org. You can book an appointment with a Planned Parenthood health center. And so you can go in and request online. And we had a 450% increase in the requests for IUD appointments.
Wow.
And that's because women started to realize, well, maybe I didn't need this right now, but next year I may want it, and I may not have access to it anymore. And we've actually had patients come in, and because they're looking at the long term and they do not trust what's going to happen, we have had women come in and say to our health center staff, I want a method of birth control that will last through a presidential term.
That is amazing. Wow. That is how frightened people are.
And I do want to stress, though, that when we've had this upsurge in interest, at Planned Parenthood we do recognize that every method is not appropriate for each patient. So every patient that comes in, even if she has in her mind that she wants a particular method or needs something, we still go through the whole education and talk to them about what is best for them, both for their lifestyle, what their goals are, and also their health. I'll give you an example. The day after the election, I got a text from the daughter of a very good friend of mine who used to work at Planned Parenthood. Her daughter is in college, she's a junior, and she texted me and said, Brigid, I need to know, should I go and get an IUD? She lives in another state at school. And she's not dating anyone right now. She doesn't need it, but she's like, right now I know I have this insurance coverage. And so should I do this? And I said, if you don't need it right now, the Affordable Care Act's not going away tomorrow, let's think about it and let's talk about it. When you're home at Christmas, we'll sit down and chat. But that's what we're encouraging. Everybody who feels panicked, come to Planned Parenthood or go to your regular healthcare provider if it's not a Planned Parenthood. You still have coverage right now. So get your care taken care of right now. Go in if you need a physical. Go and get your preventive services. Get your children vaccinated. Whatever it is, you have the coverage now. Take advantage of that. And we're working very hard at the federal level to make sure that things are protected. And we're going to continue to do that.
I was just listening to a story on NPR on my way here that talked about how the insurance companies are not handling this uncertainty very well because they are in the process, or would normally be in the process, of creating their plans now for next year. So are you seeing or hearing anything regarding any particular way insurance companies are going, or I know everything just seems to be up in the air right now.
Well, that's a really good point to raise. A lot of this stuff is planned way out in advance. You have to make sure, insurance is a very complicated system. You first have to estimate all your benefits and figure out what your benefit package is. Then you have to make sure you have a provider network that's going to be able to provide those services. And you've got to figure out where you're going to be offering your plans. You can't turn around and change that in a month. So there is a great deal of anxiety in the healthcare sector, whether it be the insurance companies or healthcare providers, major hospital systems that are wondering what is going to happen and will people still have coverage and what kind of coverage will they have. So we hope that there will not be a repeal without a replacement, because that really leaves a lot of us in limbo. And it's a concern for patients, for very personal health reasons. It's also a financial concern, not just for patients who may now be paying out of pocket for more things or have no coverage at all. It's also a financial concern for providers who don't know, are the people who are going to be coming to us have insurance, or are we going to start going back to the old days where people would show up at the emergency room with no insurance and be in an acute condition for a chronic disease like diabetes that would have been treated, and now we're doing more charity care and we're carrying more debt. And it's a concern for the insurance industry, who they don't know how to predict their financials. So that is one of the things that has come out. The Hospital Association said that with a repeal, and if we were to just dump the Affordable Care Act and not know what we're doing, it could potentially be layoffs in communities all across the state. It could be cutting back on care. We will see the benefits and the progress we've made in prevention on a lot of things decline, including, and this is one of the things I care about, right now we've seen a new report just came out within the last month that says that abortion rates are the lowest. There were at record lows. Teen pregnancy rates were at record lows. And it's because the overall pregnancy rate is down because there's greater access to birth control. And that really is a benefit of the Affordable Care Act, which focuses so much on prevention.
So it seems a lot of that is falling on deaf ears in Washington right now, and has been among some folks for quite some time. And, related to that is these constant threats to Planned Parenthood, at least at the federal level. What can folks do to support Planned Parenthood as what seems like an onslaught of criticism will continue to occur and new threats for defunding?
Yes, so you brought up the big one that is of the greatest concern to us at Planned Parenthood. We're fighting multiple fronts at the same time. We're very concerned about the Affordable Care Act. We also are very concerned about Medicaid coverage. And then there's been a particular attack targeting Planned Parenthood that has to do with funding. And I first need to explain how Planned Parenthood is funded. That's really, really important. Planned Parenthood is not a line item in the federal budget. We don't get this big fat check that we get to take and use however we want. What we do is we participate as a provider in certain healthcare programs, the largest of which is the Medicaid program. There's also a program called Title X. It's the National Family Planning Program. And I always love, especially in the current political climate, to point out that the Title X program was sponsored in Congress by George Herbert Walker Bush.
Well, how about that?
President Bush 1. It was signed into law by President Richard Nixon.
Wow.
That's how far we have come, is that back in the 70s, family planning was a bipartisan issue. It was viewed as a public health issue. And we need to get back to that, to see that there's a direct connection. So the word is, and President Trump is supportive of this, and it looks like Congress wants to do this. There are two things they want to do. They want to cut Planned Parenthood out of the Title X Family Planning Program and say that we can no longer bill for services to that program. And it really is reimbursement for services. It's for women coming to us for their annual exam, their Pap test, their breast exam, STD testing, birth control. And the Medicaid program, which is a very large percentage of our patients, and that we would no longer be allowed to participate in that program as a provider. The history is that under Medicaid, if you are a willing and qualified provider, you are accepted into the program. And that is because not everybody wants to be a Medicaid provider, and there is a shortage of them. So it makes sense that if you are qualified as a provider, you're doing the quality work, and you are willing, that you should be part of the program, because the goal of the program is to serve people who don't have access to care. What the Congress and the President are talking about doing is targeting one organization that nationwide serves over 2 million people.
Wow.
And saying, because we counsel, refer, and perform abortions, that we cannot participate in these other programs. I want to be clear that abortion is not funded through these programs. Mm-hmm. There are federal laws that restrict it. The Title X family planning, none of that money can go towards abortion. It is clearly, we bill, there's a Pap test, we bill for the Pap test, we get reimbursed for the Pap test. Same thing in Medicaid. In Medicaid, there's the federal Hyde Amendment, and that limits abortion coverage only to women whose whose life or they've been raped or they're victims of incest. Mm-hmm. And then under the state court order, there is also a health exception in Illinois. But that's very limited. Very few women in Illinois get abortions through Medicaid. We provide abortions to women who are on Medicaid at Planned Parenthood. We do not bill for them. Mm. So we use private funding, or the women pay for them themselves. I do not believe that it makes any sense for Planned Parenthood, because we provide these services over there with separate money, that we are cut out of a program that we're providing to thousands of people across the state of Illinois, that is fundamental, basic, preventive health care that is essential for people, and often we're the only provider that they have in their community.
Thank you so much for clarifying that. In this day of alternative facts, we really need to hear the truth over and over again, and folks need to amplify this message. Mm-hmm. So give the website again.
Okay, so if you want an appointment, you go to www.ppil.org. If you want to speak to your senator, reach out, support, become an advocate for Planned Parenthood, go to www.istandwithpp.org. So those are the two websites to remember.
I Stand with PP. I love that. Mm-hmm. So thank you so much, Brigid, for coming on to the show. I think we're going to ask you to come back again.
There's so much more to talk
about. I know, right? There is a lot. So thank you all for tuning in. I want to remind folks, too, that Pride Action Tank has a sleep-in on February 24th to bring awareness to youth homelessness and to raise money for organizations that serve youth. And you can find out more about the sleep-in at our website at prideactiontank.org. We do this show on the first Friday of the month at 6:30, and we look forward to seeing you back in March. Thank you.